Welcome to the Cystic Fibrosis Foundation's CF Education Day webcast, CF Infant Care, the First Year of Life. I'm Melissa Chin, Clinical Program Specialist at the CF Foundation. This webcast is hosted by the Cystic Fibrosis Foundation and supported through an unrestricted educational grant from Genentech. To learn more about CF clinical research, CF lung health and disease, nutrition, germs and infection control, health care coverage, and more, watch an archived webcast on the CF Foundation's website. Joining me today is Dr. Frank Accurso. He is the Associate Director at the CF Care Center at Children's Hospital, Colorado, and the Professor of Pediatrics at the University of Colorado in Denver. Thank you, Frank, for joining me today. So the first question I have is one that a lot of parents ask, and that is, what does it mean for my baby to have CF?
Well, it means that the baby requires all regular care that infants without CF would need, but there are extra medical problems that need to be dealt with. So the infants have to be seen. It's best that they're seen at accredited CF centers. And this is because CF is a condition that can affect a number of organs in the body, bringing about the need for extra medical care. One organ is the pancreas. The pancreas makes chemicals, digestive enzymes, that help us break down food. And in CF, the pancreas doesn't work so well. So the infants have trouble gaining weight and growing at a time when they have to gain a lot of weight. Infancy is a time when the growth is really at a peak. Another organ involved is the sweat gland. Infants can lose salt in the sweat, and this can lead to dehydration. Furthermore, infants with CF are prone to intestinal obstructions, and that's something that we always have to watch for. But really, the most important organ involved in CF is the lung, and there has to be very good attention paid to any lung problems that might come up in infancy.
So how is caring for a baby with CF different from caring with a baby that does not have CF?
Well, the infant with CF needs all the care and love that an infant without CF would need. But on top of that, there should be visits to the regular Cystic Fibrosis Foundation accredited CF centers, and then all the care that is normally provided through primary care practitioners, be that pediatricians, family practitioners, nurse practitioners, as part of the whole CF care team.
So what is the basic information that every parent and family member should know about taking care of a baby with CF?
Well, I think speaking medically now, there are certain symptoms that you have to watch for that are very important for caretakers, parents to be in tune to. And these symptoms are especially cough, vomiting, abdominal pain, lethargy, and decrease in appetite.
You mentioned accredited care center earlier. Why should a parent take a baby with CF to an accredited care center?
As medical problems can arise, you need people who are experienced really with CF. And the personnel at the CF Care Center have tons of experience. And they've met many hundreds of families with CF and learned from them. So there are physicians and nurses, nutritionists, social workers, respiratory therapists, often psychologists and other members of the team who can really help the family and the infant deal with these problems and try to minimize the impact of any healthcare problems.
Should a parent also take their baby with CF to see a pediatrician as well?
Yes, it's important to see a pediatrician or, again, a family practitioner or a nurse practitioner. whoever the primary care provider is, because all the regular care, immunizations, for example, testing, that needs to be done as well.
We also have a question that we get a lot, and it's why is it important for babies to get enzymes?
Okay, it's important for babies to get enzymes because without them, they can't really make use of the food they eat. The nutrients can't be digested and then absorbed. So without the enzymes, the infants have great difficulty keeping up in terms of weight gain and growth. There are some infants with CF who don't require enzymes, but the vast majority do require them.
Now, can a baby with CF be breastfed?
Yes, we encourage breastfeeding. It's the way to go if it fits with the family's lifestyle.
Now, you talked about nutrition. Let's move to lung health. How can a parent with a baby with CF keep their baby's lungs as healthy as possible?
Well, there are a couple of things that can be done to try to keep the lungs as healthy as possible. The first one is to avoid exposure to tobacco smoke. There is very good evidence that tobacco smoke is a problem. So it means that parents or other caregivers have to think about this. It's the toughest thing in the world to think about. But we try to provide information about quitting smoking. There are a number of good studies that show that that affects lung health in infants with CF. So the primary care provider for the infant or for the parents or the CF center can help parents work through that. The second thing that can be done is actually to avoid people who are obviously infected with a cold. The parents always ask, well, how about if I have a cold? And my recommendation is very good hand washing. Hand washing will do a lot to prevent transmission to the infant, but you can't completely prevent colds.
What about airway clearance? I hear a lot about airway clearance. What is it, and why is it important to do it?
Well, we think it's important because the lung problem in CF arises from thick, sticky mucus that hangs around in the bronchial tubes or the airways, and then this mucus gets infected, and it can lead to serious infection. So we try to help the infants and children with CF clear this mucus, get it to the point where they can cough it up. And to do that, we use a variety of physical means. And the first one we usually teach him is chest percussion, which means gentle pounding on the chest to kind of shake the mucus loose. And that's part of the airway secretion clearance program. There are other techniques that the kids develop later on.
At what age can you start airway clearance?
Well, we've talked about this quite a bit, and there are guidelines that deal with this issue among many others, and these guidelines were developed by getting a group of people, including families, parents of infants with CF, together and discussing the issues and looking at evidence. And what the guidelines came up with is airway clearance should be started in the first 3 months of life. Few months of life, it actually says, but we usually take it as 3 months.
Now I want to switch to another commonly asked question, that is, can a baby with CF be sent to daycare?
Okay, we usually say that daycare should be approached according to whatever fits in the family's lifestyle. So if they were going to plan to use daycare, we think they should. Daycare is fine. We make no recommendations in terms of restriction on daycare.
And what is the best way to educate the daycare about how to care for their baby with CF?
The best way to provide information for the daycare groups is to work with the CF Foundation accredited care center to get material, written material that cover most of the problems and most of the issues with CF. A lot of people tend to surf the net. I don't know if that's the right phrase these days, but the information is often not completely vetted, so we try to give them written, specific material.
Okay, the next couple of questions are ones that we actually get a lot from the public, and that is, what is the life expectancy of a child born today with CF?
Well, it's very difficult to say what's happening because in terms of a child born today. I actually expect them to have close to a normal lifespan or life expectancy, and I think families should plan for everything, school, college, future families, jobs, whatever they would plan for a child without CF should be planned for with a child with CF. And it's true that the reported median survival is around 37 years, but those are people who were born 37 years ago. And so I think and things are getting very much better for infants with CF. So I would plan for close to an expected survival. Now, every once in a while, very rarely these days, but every once in a while, the problems in CF are so severe that a child doesn't make it out of childhood. Mm-hmm. Okay, that could happen. Mm-hmm. But most of the kids are doing very, very well, and I think have an excellent chance at good survival.
Can you tell how severe CF will be in a baby?
We can't really predict, because there are some infants who have a difficult course in the first year of life, and then not for years or decades afterwards do they have problems. And there are some infants who sail through infancy and then problems show up in childhood. So we can't really predict who's going to be severe. We have a rough chance at predicting who will need enzymes and who won't need enzymes, but even that isn't 100%. So I'm afraid the best way to approach CF is to take every problem as it comes along and make it better.
How often are babies with CF admitted to the hospital?
In the first year of life, it's close to 20% who need to be admitted to the hospital for one reason or another. But after that, the frequency decreases until adolescence, the frequency of admission, hospital admission. And even in adolescence, not all are admitted. So it's a little hard to say, who's going to be admitted, but we know that the first year is key. Sometimes we have to use hospitalization a little more than you do later on in childhood.
As a child grows up, because they have CF, and this is it does affect the lungs, does that mean that we should limit their physical activity?
Well, no, we don't think the physical activity should be limited at all. And it should be, again, what fits in the family's way of life and what the child is inclined to do. You can't say whether everybody wants to be an athlete or not, but I usually tell families that if they have to limit physical activity, then we at the CF Center are not doing our job. We should be able to figure out how they can have full activity.
Great. Last question. What is the most important thing someone taking care of a baby with CF should know?
The most important thing is that the child needs all the care and love that any infant without CF requires, but that there are medical problems that will come up, and they require extra attention. And that there'll be a team involving the primary care providers, the family, of course, and the CF Center that will help families deal with these problems.
Thank you, Frank, for that valuable information. For more information, you can go to the CF Foundation's website. To read information about the infant care guidelines, go to Treatments, CF Care Guidelines, and then click on Age-Specific Care. The guidelines cover airway clearance, nutrition, and how to visit a CF accredited care center. To find a CF Foundation accredited care center near you, there is a link under Quick Links. Go to Care Center Network and then click on CF Foundation Accredited Care Center. Here you will find an interactive map of the United States where you can click on the state you live in or enter the zip code to find a CF accredited care center nearest you. Another resource is Infant Care for CF, the First Year of Life DVD. Hear from parents of children with CF and members of the care team about how to care for your infant during the first year of life. To learn more about the DVD or how to order a copy, ask your local CF Accredited Care Center or email info@cff.org. This concludes the CF Foundation's CF Education Day webcast, CF Infant Care, the First Year of Life. I want to thank you for watching, Frank for giving us some valuable information about how to care for your infant during the first year of life, Rick Vasta and the technical crew, Leslie Hazel, Melissa Muller, Genentech, and the CF Foundation for making this broadcast possible. Thank you.